Добрый день, меня зовут Жанна Кремес, и я работаю в области обучения миофункциональной коррекции и нормализации дыхания. Сегодня наша с вами гостья– это специалист международного уровня в области обучения миофункциональной и дыхательной терапии. Джессика Maidman из Австралии отучила сотни специалистов в Европе, США, Австралии, Японии и других странах самому современному и эффективному подходу во внедрении миофункциональной терапии в рамках стоматологической и ортодонтической практики. Все знают, что самым сложным аспектом миофункциональной терапии является не сама техника, а мотивация пациента к регулярной работе над собой и соблюдению ваших рекомендаций. Сегодня Джессика расскажет нам о том, как она рекомендует выстраивать контакт с пациентом и систему терапии в целом для достижения оптимальных результатов и здоровья ваших пациентов. Thank you, Jessica. We can get started.
Thank you. Hello, everyone. Today we're going to talk about compliance, and I actually work in the Miobrey's centers. Now, in our centers, we use a myofunctional appliance, and every day we get thousands of kids to wear the Miobrey's for 1 hour while they're awake and every night while they're sleeping. And we also get these kids to practice 2 minutes of exercises morning and night. Now, a lot of people ask us, how do we actually get these kids to comply with this treatment? And today we're going to talk about some of the tips and techniques that we use every day in order to facilitate the kids to be involved in the solution to their own problems. So the first thing I wanted to talk to you about was motivation, because compliance actually comes down to being able to stimulate motivations within the patient. So what we actually need to do, and we call ourselves in the Miobrey's centers, we call ourselves educators, because the very first thing that we need to do in order to help the kids be compliant is help to teach them what their problem is and what they can do to be a part of the solution to that problem. Now, there's definitely some tools that we're looking for, and some attributes that we teach into our educators, and that's what I've got here on my screen. So we try to be as positive as possible, always having something happy and encouraging to say, because that definitely helps the children that are in treatment know that this is a happy environment when they come to their appointments. The next thing we do is we always try to create fun around the tasks that we ask our patients to do. If the task is fun, they're more likely to participate. We want to be as relatable as possible to these kids that are coming in to treatment. So by having young, enthusiastic, and encouraging staff, they're going to be more relatable to the patient than someone that might be just very authoritative. The next thing that we do for our kids to help them stay motivated and compliant with their treatment is we give them clear instructions. And if the patient struggles with those clear instructions, the next thing we'll do is we break those instructions down into manageable goals. So once we've broken the instructions down, we are then able to build on top of what we've asked the patient to do in order to reach the desired outcome. And something that we work something that we monitor quite well in our practices is trying to encourage autonomous learning and strength-based learning. So to talk to you about only compliance, I have to first talk to you about motivation, as I mentioned before. And what is motivation? Motivation is the action for the energy, okay? So what drives a person to perform the task that we're asking them to do? So there's 2 types of motivation. The first you can see on my screen is controlled motivation. Now, we tend to use controlled motivation quite a lot, and it's things that aren't necessarily that good for this type of treatment. This is things like reward programs. that we are seducing the kids to be a part of the action because of their reward. Sometimes we are seducing the kids to be a part of the action because of a threat of punishment. Now, this type of controlled motivation where we are forcing the child to do the action means that normally we see the kids take the shortest possible route to achieve the action that we're asking them to do. And this creates a lot of stress and anxiety for these kids as well, especially if there is sort of that threat of punishment. All of these things within the controlled motivation causes bad feelings around the task that we've asked them to do. So that creates a lot of negative feelings. Now, within our centers, we don't want our patients to have negative feelings about a really positive treatment that we offer. So what we want to help our patients do is have autonomous motivation. Autonomous motivation means that they are going to show willingness by themselves to complete the action that we ask. And how do we get the kids to want to do the action? Well, in order to stimulate the child to comply, they need to understand why they are doing the exercise. They need to value and believe that the behavior will equal the desired outcome that the child wants. If the child doesn't want that outcome, then it is more of a controlled motivation environment. So how do we actually get the kids to be more, to value and believe? We spend a lot of our time on education. Now, within the Miobrey's centers and within MRC, the Myofunctional Research Company, we create a lot of tools that actually help you facilitate education towards the patient in order to create autonomous motivation. Now, if we can help the patient be involved, then rather than negative feelings, they are generating a lot of positive feelings. Because the positive feelings around the achievements that they're making helps them and motivates them to do a better practicing more often, and we see a much better result. So when we talk about autonomous learning, we also talk about strength-based learning. Now, strength-based learning is based around some key principles, and we try to work off these key principles every day during our appointments. So the first thing that we're going to look at is acceptance. We want the patients that we treat to realize that they have a myofunctional issue that's causing them to either have a tooth issue or more likely a pediatric health problem. So the first thing that I would like to do is help the child, the patient, the parent as well, understand what that problem is. Okay, if they can understand what their problem is, then they can make a choice in being a part of the solution. And the way that we do that within our practices is by using the consultation app. Now, I believe that in Russia, there is the Miobrey's first consultation CD-ROM, which is currently available, which does an excellent job at helping you educate the patient as to what their problems are, why the patient has crowded teeth, or a jaw development issue, or a craniofacial development issue, or more likely a breathing and pediatric health problem. This is where you're going to, for the very first introduction into this treatment, where you're going to have the most successful result is if you spend the time doing this first consultation. Because this will set your patient up with being compliant or having that autonomous motivation from the start to the end of the treatment. The next thing that we look at is trust. Now, This also comes back to value and believing that the treatment is going to equal the desired outcome. So how do we help the patient understand and be motivated during the course of our treatment? Is we do that with monthly visits to our practice. Now, at monthly visits to our practice, we actually help and explain what the Miobrey's treatment is trying to do, what our myofunctional appliance is doing to help the patient, as well as what each exercise in the series of myofunctional exercises that we use is trying to achieve. Now, as you can see here, we've got a whole bunch of really child-friendly animations, and those animations are there because they're there to train and teach the kids, and we use interactive apps and education material to actually reach through to the patient so that it's not just coming from an authoritative figure, it's coming from something that they're used to using, like their device or their tablet. As you can see here, our practices are set up to be very child-friendly. So we've got lots of colorful surgeries. We don't have large, chunky dental equipment that can make a child feel uncomfortable. Our activity rooms are set up so that there's no dental equipment. So when we are actually working through myofunctional exercises, it's in a space where they don't feel like they're at a dentist. Now, we believe that's very important to help them be in an environment where they can have the best chance at learning. Now, people learn in 3 ways. We learn by hearing, that's someone talking and telling you about a certain thing or an idea or a philosophy. We learn by seeing, so using visual prompts, like you can see the girl on the screen is using an interactive app through a screen, and this is giving her visual cues as what we're wanting her to learn from each time she comes to the clinic. We also learn by doing, the action of. So at every appointment, we not only communicate with our language, positive language, encouraging language to our patients, we also help them learn through devices and apps that they understand how to use and it's interactive. But we also get them to perform the exercises for us, and we get them to do it as well. That way, the patient is set up, they understand what they're trying to do, why they're trying to do it, and then they can take that home, more likely going to be compliant with the action that we've asked them to do because they understand why. The next thing that we're going to look at is care. A lot of the times, these patients are coming to the practice or coming to you for treatment, and they're there because they have a tooth problem. That's what we see in our centers. And it's our job to actually help them understand that a tooth problem or a tooth alignment problem, malocclusion, is just a symptom of a larger health problem. And that we don't want to just correct the tooth alignment problem. It's our job to actually help them correct their own pediatric health problem. So we do this with our first consultation as well, and we consistently do this throughout their appointment so that they understand what their problem is and what actions they need to take in order to be a part of that solution. This will then help facilitate and stimulate the fact that they care about their treatment, and they're, again, more likely to participate. The next topic we're going to talk about is choice. Now, children like to have control of what they're doing, especially the older kids. If you allow yourself to hand over, as a practitioner, hand over some of the choice to the patient, then they are involved in that decision. Then they're more likely to do the task to which they chose because it was a decision that they made. So what we do is, rather than saying, can you practice these 3 exercises, we'll say, how many exercises would you like to practice this month? You can practice 1 exercise, 2 exercises, or 3 exercises. We allow the patient to decide based on the education and the conversation that we had at the appointment. Now, most of the time, depending on the kids, they choose the right option. If you've spent the time explaining to them why practicing 3 exercises is important, then when you give them the choice, they will normally agree and make the choice to do that action. Encouragement. At every appointment, we make sure that we use positive language to encourage the kids. Kids want to be, they want to please, especially if you have the right people in the right positions and that your language is helping you to make a nice connection with the children. When they come back to the practice, they want to impress you. They want to show you that they've done a good job. Now, if someone isn't doing, say, a task that you've asked them to do perfectly well, and you say, no, that's wrong. I wanted you to do it like this. At home, they feel as though that they've done the task that you've asked them, and they're coming to the practice hoping to show you the good job that you've done, and you've given a negative response to them. That negative response generates more negativity. Then they feel bad about the treatment and they're less likely to comply. However, if you use positive strength-based learning to encourage the children to do better, rather than saying, no, that was wrong, they're more likely to put the extra effort in. For example, rather than saying, no, that was wrong, you would say, what you did really good was this and this. Where do you think we can improve? So again, I've given it back to the patient to make the choice and to make it a discussion about what they think that they can improve on. And then you can discuss further about that you can improve on this or that. So it doesn't make them feel like they've done a bad job. It helps to keep them motivated and they're a part of the decision and the discussion. Finally, in order to keep our patients motivated, we have continued education and communication. And as I've mentioned, we have lots of tools that are available to you guys through the Myofunctional Research Company to help you stay on track with continued education. And one of my favorites is the first Miobrey's first consultation. My next favorite is one of our Miobrey's exercise programs. And finally, we have a new resource that's available, which is called the Miobrey's Educators Check Form. Now, we use this check form in our practices to assess the patient's compliance, the patient's motivation, and the patient's improvement in their function over the time at which they're in our treatment. But we use this information to actually consistently and continually educate the patient. Now, these type of resources are available to you when you attend MRC for courses, as well as if you want to contact the MRC representative office in Russia. But just to finalize things today, a lot of people ask me, how can I make my patients be more compliant and motivated? And my answer to them is, it's not about how can you make them be more compliant and motivated. You need to take that thought away and rather replace it with, how can I create the conditions in which my patients will want to comply and motivate themselves? And as an educator, I know that that comes from having the child understand why they're doing the exercise and how to correctly do the exercise and what that exercise is trying to achieve. If you can do that, then the patient is more likely to be motivated and comply with the treatment. Now, if you're wanting to learn more about the exercises or about our treatment, then it's very difficult to cover everything in just a 20-minute chat, but we do cover everything in a lot more detail about myofunctional exercises, about our treatment, and about the Miobrey's appliances and what they can do for you and for your patients. So if you would like to know more, you can visit miobrey's.ru to learn about all the courses that are available to you in your region.
Thank you very much, Jessica. I have a couple of questions that I would like to ask you for our audience. If you could stop sharing your screen so we can both be visible.
Mm-hmm.
Excuse our technical things.
Okay, no worries.
Yes, so one of the questions that practitioners often ask is, what is it that I do that I've already done something wrong, the patient has lost motivation, how do I regain it back? So what do you recommend to patients that have, that are coming?
They're already feeling deflated.
Yeah, they're coming for their checkup visit and you have noticed that they haven't been doing the exercises and they haven't been wearing the appliance. What do you recommend?
So what we do within our centers is we have a special appointment where we talk to the kids and find out why. Sometimes kids, sometimes we get so busy with our appointments being very quick that we don't actually spend the time to talk to the kids about what's going on, why are they not being compliant, why do they feel a certain way. And a good person to do this is someone that's not the dental practitioner, that's not the authoritative person. So having educators or a treatment coordinator actually talk with the child. And it's not so much a conversation with the parent, but actually the child. And you'll find out a lot if you just have the conversation with the child. Now we, for example, I can give you an example. We had a young patient, a young girl in our practice that was very compliant to start with her treatment. And she all of a sudden dropped off compliance, was feeling very bad and negative about the treatment. Now we had a conversation with her and we asked her, what's going on? Why you don't want to be as compliant as you used to be? Do you have anything that makes you feel bad about Miobrey's or about the treatment? And she actually told us that she was so excited about her treatment, that she was so excited about her treatment results that she created a presentation and did sort of like a share at school about it for her class. And after, the class laughed at her and they bullied her about it because they thought that what she was doing was funny and it was silly because they didn't know about it. And that made her feel really sad and that made her feel really negative about the treatment. And because she was being bullied at school, it made her feel that the treatment was not relevant. So I guess what needed to happen was to actually find out or have the conversation with her so that we as the encouraging, positive, educators could talk to her and say, this treatment isn't for anyone else, that it is for her and that it's going to do good things for her. And we were able to help her be motivated and compliant again. So that's one thing you can do. Some kids definitely react to being told that they're doing something wrong. As I mentioned before, if you're using language that isn't encouraging and supportive and motivating, then kids feel deflated. They feel as though what they did wasn't enough. And they're so busy nowadays with, not sleeping well, not being able to have a full rested night's sleep, all of the school activities, after school activities, their homework, chores, and then on top of that, we're asking them to take up more of their time doing something. When they come to the practice, if they're told that what they're doing is wrong or not good enough, then they start feeling deflated. So rather than saying these sort of negative words, we want to encourage more positive actions. For example, how many times a week did you practice your exercises? 3 times. What do you think, rather than saying, no, we want you to do it every single day, well, I would say something along the lines of, that's a good job. That's about half of what we need you to do. What do you think we can do together to help you find time to do it more often? So I am still saying the same thing. I am still saying, I need you to do it 7 times every single day, 7 days out of 7. But rather than saying you should do this, just do this, it's a discussion, it's a choice. What can we do together to help you be able to do it more often? What's stopping you from being able to do it? And then we can overcome those hurdles together. So I guess it really comes down to the language that you're using. And I never think that that it's too far gone to change your approach or change your language that you're using with the kids to help them sort of get back on track.
I see. Thank you so much. And just to elaborate on that, how would you help a child incorporate more times during the day to wear their removable myofunctional appliance as well as doing the activity?
Mm-hmm. So sometimes the kids just need like simple tips and tricks that they can use. Some things like we tend to find the easiest way to get them to do it every single day is to tack it on to something that they're already doing every day. So this works really well with kids that have routines. Most kids nowadays have routines because they're going to school, they're coming home from school, they have a certain series of things that go on. So if you can allow the child to make the choice as to what activity they do every day that we can tack on the exercises, for example, to, or when during the day can we find the time to do the hour and we can tack it on to something, then they tend to sort of have a better routine to follow. Whereas if you don't help set up or establish that routine with the patient, then they are left up to their own devices, and often they don't recall or remember to find the time to put into this type of thing. So we might say a good time to do your exercises is when you brush your teeth in the morning and when you brush your teeth at nighttime. That's 2 times per day. You want to brush your teeth for 2 minutes and practice your exercises for 2 minutes in front of the mirror. Some kids eat breakfast at the dinner table and then eat dinner at the dinner table. So a good time to practice the exercises is to tack it on either before or after dinner. Some kids will come home every single day and pull out their homework and start doing their homework straight away. So they can tack on their exercises either before or after their homework. So these things are consistent in their daily life. We're just helping them choose, again, it's their choice, which one they want to tack that exercise or the use of the appliance onto, which daily activity that they're already doing.
I see. So you're suggesting, for example, that they do the exercises before they do homework. While they're doing homework, they can wear the Miobrey's and then finish off with exercises.
Yeah, that's right. Yeah.
And Jessica, one more question that during your practice with different dental practitioners that you teach all over the world, what are the most common mistakes that you see that makes the treatment not succeed? What is preventing the dentist treatment from succeeding? And so that our audience knows what they need to avoid doing.
Mm-hmm. I think one of the biggest mistakes that I see people make is they know as a practitioner what the myofunctional appliance is going to do for the patient, but they neglect to share that information with the patient. They tend to just communicate that to the parent. So the problem with just communicating the treatment to the parent, which as dental practitioners we're very used to doing, is that it's not actually up to the parent to participate in this treatment. It's up to the child to participate. So it really needs to be the communication about the myofunctional appliance needs to be given to the child. It needs to be delivered to the child in a way they understand. So simplifying, what the myofunctional appliance is going to do for the patient is very important. And simplifying what the exercises are doing for the patient is very important. And we believe at MRC that the Miobrey's first consultation CD-ROM and the new to be released Miobrey's first consultation app does that very well. It takes a very complicated, subject, and it simplifies it in a way that a child will understand. So again, it comes back to education. And if you are skipping over that step by not delivering a consultation and talking to the child about the treatment, and the parent as well about the treatment, then you're sort of setting yourself up to fail, because you'll be consistently working on a coherent, based motivation rather than that autonomous based motivation. You'll forever be in a controlled environment where it's the child doesn't understand what they're doing, they don't know why they're wearing it, they don't fully understand what it's doing for them, and so they're just forced to do it.
I see. Thank you very much, Jessica. We appreciate your time a lot, and I wish you all the best.
Thank you very much.
Thank you. Goodbye.
Bye.